Hi, welcome to the show Food for Life, and this is your host Dr. Saxena. And I've been talking on some of the areas where certainly this is quite essential. I want to talk about something like sun gaze today. What's happening is we are uh, unknowingly we are trying to avoid the sun, and which is a major cause of mortality. I would like to quote here a study of 2017 which showed the sun exposure habits have a lower mortality. The women with active sun exposure habits have a lower mortality than those who avoid it. And it has been seen mostly in the geriatric age group that these people are not able to get into the sun. And the thing is, you are slowly getting into some of the problems with that. Um, See, what happens is that kind of a lot of studies were done, and one of the things which increase risk of heart disease and cancer aren't the only problems caused by lack of exposure. It is we as a thing. I used to think that it's only the cardiac as well as the this one. Now we understand it is because of it. Even the diabetes, even something like multiple sclerosis, autism. You have got Alzheimer's disease and all something like age-related macular degeneration, and there are some specific cancers also. They are related with the low uh, sun exposure. Um, the people who apply something like sunscreens to try to prevent that sunburn and all that, they have got the increased risk. And you have got multiple studies which show that hazardous ingredients in this sunscreen, usually called oxybenzone, can cause infertility, birth defects, some disruption in the children, and even the risk. They're not just. It's not just the humans they are affected. You have got the sunscreens which are destroying even the coral reefs. So a kind of big take here as such, and always. We are over a period of time, maybe around some since last 2 decades, every physician now, and even every patient tries to look into what is the vitamin D levels, what he or she is having. And you need to be you need to know what's happening at the D level as such. But I can always tell you, you don't have to wait till your D levels get plummeted. And if you have some simple signs, you have got the symptoms. Usually, the symptoms are constant aches and pains, and they are usually misdiagnosed. So one day you'll have a pain in the shoulder, another day in the neck, another day in your knee joints and all that, and it is not properly picked up by the this one. Um, you may have, when we have something like vitamin D which is low, the second normal common say constant thing what we have seen is you get into frequent illness and infections due to low immune system. You get something like headaches to cognitive impairment because of this neurological symptoms of this vitamin D deficiency. Yes, mostly what I believe, I have seen scores of patients, and I felt even I'm also having that problem. It's something like low back pain, daytime sleepiness, you have fatigue. This if I can go, if we can always look into that. This is nothing but big than just vitamin deficiency. You can have something like sweaty head, and this is it can occur at any age. You have got uh, sweating at the face and all that. This is one of the signs of you have got something like low vitamin D. This is the time you should always try to look into something called sun gazing and all that. And what are the when we talk about this, see, there are a lot of risk factors and all that for sun exposure. People started looking into what are the things as such. See, you need how much do you need the sunbath during the summertime? What is the kind of winter you used to? What are the things called tanning beds? And so see, I believe you have got a simple thing which is called sunbathe, and just by avoiding stopping that, to avoid that sunlight will make you much better. And you should always try to look into what are the natural things which are available. So purposely avoiding the sunlight, putting a sunscreens and all that, I think it's not logical, because this causes a lot of cardiovascular problems. It leads up to cancer. You have got a number of things, all chronic diseases lined up between this particular thing. A lot of emphasis was given on something like a relation between sun exposure and the skin cancer. And I had in my practice in around when we are living in this country, there must be people who are living far away from the equator, they may be having this problem. But people who are living in the tropical countries, I don't think that's a big issue as such. And I certainly would like people to understand not to put this stupid sunscreens and all that, because this is one thing. By when you do all this stuff, you cannot optimize your vitamin D. And when how do you optimize your vitamin D? First, you need to understand what is your level, and what is the kind of there is a thing called D calculator which try to work it out. And we believe it should be between 40 to 60 nanograms per ml. And this is very very pertinent, and I think you should always retest in another 3 months or 6 months time again. And I would like to correct this particular things by doing some simple measures, and with that, a kind of simple strategy, try to look into what is your vitamin D. For to have a good vitamin D, you don't avoid the sunlight, and that is the basic catch here. And if we can follow that catch, it is like a simple thing where we are trying to ward off these chronic diseases. And we can always remove that this from that ease, and keep it separate. That should be the kind of ideal this one assets. Thank you.